Admiral Levine is here, and so is Dr. John Balbus. So I would like to introduce Dr. John Balbus, who is then going to introduce the Assistant Secretary for Health, Admiral Rachel Levine. John is well known to the consortium. He was at the very first organizational meeting to brief us on the 2016 National Report on the Health Impacts of Climate Change in the US, for which he was a lead author. He served on our advisory committee from the very beginning, and then our advisory board, and has regularly offered helpful advice. He's been a collaborator, a leader. We're delighted to have him working with us over the years, and delighted that he's here. Today, he's the head of the Office of Climate Change and Health Equity, which sits within the Office of the Assistant Secretary for Health, which is the highest level health position in the government. And so welcome, John.
Great. Well, thank you so much, Mona. It really is indeed an honor and a pleasure to be part of the Medical Society Consortium annual meeting, and especially to be asked to introduce my boss, Admiral Rachel Levine. Admiral Levine serves as the 17th Assistant Secretary for Health for the U.S. Department of Health and Human Services, having been nominated by President Joe Biden and confirmed by the U.S. Senate in 2021. Admiral Levine is also the head of the U.S. Public Health Service Commission Corps, one of the 8 uniformed services. After graduating from Harvard College and the Tulane University School of Medicine, Admiral Levine completed her training in pediatrics and adolescent medicine at Mount Sinai Medical Center in New York City. As a physician, she focused on the intersection between mental and physical health, treating children, adolescents, and young adults. She was a professor of pediatrics and psychiatry at the Penn State College of Medicine, where her posts included being the vice chair of clinical affairs of the Department of Pediatrics and chief of the Division of Adolescent Medicine and Eating Disorders at the Penn State Hershey Medical Center. In our universe of medical societies, Admiral Levine, you might say, is a Hale Fellow, well met, as she has been named a Fellow of the American Academy of Pediatrics, the Society for Adolescent Health and Medicine, and the Academy for Eating Disorders. In 2015, Governor Tom Wolf nominated Admiral Levine to be Pennsylvania's Physician General, and she was subsequently unanimously confirmed by the state Senate. In March of 2018, Admiral Levine was named the Pennsylvania Secretary of Health. And in making the move from academic medicine to government service, Admiral Levine has continued to demonstrate capable leadership, serving as the president of the Association of State and Territorial Health Officials. In addition to her recent posts in medicine and government, Admiral Levine is an accomplished speaker and author of numerous publications on topics from the opioid crisis, adolescent medicine, eating disorders, LGBT medicine, and now increasingly climate change and health equity. Please join me in welcoming Admiral Rachel Levine, the Assistant Secretary for Health.
Well, good afternoon, everyone. And thank you, John, for your very kind introduction. Thank you for inviting me. And I want to also thank you for hosting this session on this critically important topic, especially critically the week that the IPCC report came out, which dramatically underscores the need for unity and especially the need for urgency in our actions. I would like to thank Gina McCarthy for all of her fantastic efforts and really the leadership of President Biden and Vice President Harris and the whole administration in the climate change space. These actions give me hope that we can make meaningful changes that are needed to create a healthier, more equitable future in the face of climate change. You know, President Biden and the administration are working across all of government in every sector to take swift and necessary action to tackle the climate change emergency, including for the health sector in our health systems. Supporting environmental justice and climate resilience are priorities of mine, of Secretary Becerra, and all of us at HHS. And we are working very hard to address climate change and its impact on health, both through a number of new actions in the department and through collaborations with groups such as the National Academy of Medicine and their Action Collaborative on Decarbonizing the United States Health Sector, which seeks to mobilize private sector stakeholders to reduce emissions. So we want to be bold in everything that we do, and we want to take concrete and swift action to protect both the public from the catastrophic and chronic climate threats and reduce the health sector's carbon footprint. And we know especially that health equity has to be critically important with this, because certain communities, the same communities that have borne the brunt of COVID-19, the same communities that have borne the brunt of longstanding environmental injustice, are at particular risk, and we need to meet their needs. Now, a major signal from the administration on the importance of climate change and health equity was the establishment of the HHS Office of Climate Change and Health Equity in August of last year. We fondly call it OCHE, and that office is within my office of the Assistant Secretary for Health, and it's an office with a mighty mission. This office was created in response directly to President Biden's executive order tackling the climate crisis at home and abroad. It is part of the administration's ambitious plan to tackle the climate crisis, and we at HHS are so excited to be part of a change that brings a cleaner, healthier future for the health of our nation and the health of the world. This office has three main areas of work. The first area aims to build the resilience of communities to the health impacts of climate change. Again, especially communities that already face more than their fair share of climate change and environmental justice burdens. We're going to work with every division at HHS across our department under the Secretary's leadership and with our regional offices, because we want to tailor solutions that meet each community's unique needs. The second area focuses on harnessing long-term recovery and infrastructure initiatives to combine climate actions with health equity. We know that the environments where people are born, live, learn, work, play, worship, and age can either contribute to people's health and longevity, or they can contribute to illness and health disparities. These disparities make people more susceptible to the health threats of climate change. So we believe that our office, OCHE, has a role in working and assisting other agencies across the department and across the administration in optimizing the health benefits of their climate change-related investments. Lastly, OCHE is working with our nation's hospitals and health systems, both private and federal, to actually reduce their greenhouse gas emissions and make them more resilient to the impacts and effects of climate change. The United States health sector accounts for roughly 8.5% of the United States carbon emissions. And the global health sector accounts for approximately 4.5% of global health emissions. So progress in this area is critically important towards meeting President Biden's goal for economy-wide greenhouse gas reductions by 2030. And we emphasize our commitment to this new office's mission to protect the health of those most burdened by the health impacts of climate change, knowing that these people are also most burdened by health disparities in general, those resulting from the COVID-19 pandemic and from longstanding environmental injustices. In November, I had the distinct pleasure and privilege of leading the Department of Health and Human Services and OCHE's representatives within the United States delegation to the United Nations 26th Conference of Parties, or COP26. And there in Glasgow, we announced the United States commitments to the COP26 health program to achieve climate resilient, low carbon health systems. This was really a unique and a watershed moment when the health ministries of over 50 countries, including the United States, made formal commitments to address health challenges associated with climate change. We committed to creating a healthier, more resilient, and more sustainable future, both for our healthcare systems and for our nation. We've taken the additional steps of supporting the implementation of a new executive order on federal sustainability that mandates that all federal facilities, including our federal health systems, those at the VA, those at the Department of Defense, those including our HRSA health clinics, achieve significant greenhouse gas reductions from energy use, vehicle fleets, and buildings. We seek to engage private sector leaders in making similar commitments to planning and action so that the nation is as prepared as possible for what's to come, addressing threats to both physical health and mental health, which we know are seriously threatened by climate impacts as well. We are systematically consulting with all of our colleagues across HHS the whole alphabet soup, CMS, CDC, FDA, ASPR, HRSA, IHS, and others, all the acronyms, to make sure that we are introducing new policies and amplifying existing ones in service of these goals. Now, as I noted, we are also actively working with the private sector, so government alone cannot accomplish all that needs to be done. I am so pleased to co-chair the National Academy of Medicine's Action Collaborative on decarbonizing the United States healthcare sector. And I would like to thank Dr. Victor Zhao from the National Academy of Medicine, all of my other co-chairs on this important work. This is made up of organizations from across the industry, and the collaborative is identifying priorities related to the healthcare supply chain and infrastructure, supply chain being critical. Health professional education, I think that was mentioned on one of the previous sessions. Healthcare delivery, as well as policy, financing, and metrics. It brings together some of the finest minds in our nation to tackle this crisis. If you're not familiar with the work of the collaborative, please check it out. In fact, there's an open call to join the network of organizations affiliated with the collaborative, and that's going to close pretty soon on March 15th. Now, while efforts to address the impacts of climate change are in full swing, we really also cannot take our eyes off environmental injustices that occur throughout the nation. Far too many disadvantaged low-income communities, including particularly communities of color, the African-American community, the Latino community, the American Indian Native Alaskan communities, and others, continue to bear the brunt of pollution from industrial development, agricultural practices, and the cumulative impacts of land use decisions, transportation, trade corridors, etc. Within the first week of this administration, President Biden directed HHS to make achieving environmental justice part of its mission by developing programs, policies, and activities to address the disproportionately high and adverse human health, environmental, and other cumulative impacts that occur for disadvantaged communities. And that is under the Secretary's leadership exactly what we plan to do. So my office is currently exercising the powers of convening, coordination, and collaboration. And cooperation, that's 4 C's, or C4. That's an explosive combination to serve as a department-wide hub for environmental just policy, programming, and analysis in pursuit of environmental justice and equitable health outcomes. We will also support the use of regulatory and statutory powers within the Department of Health and Human Services to address matters that affect disadvantaged communities and vulnerable communities on the front lines of pollution. So keeping in mind environmental justice principles, we will work alongside community-based organizations, non-governmental organizations, academia, business, industry, state, tribal, local, and territorial health authorities and governments to define and implement strategies, conduct strategic outreach and communications, and train and empower community residents. So please stay in touch for more coming up. Now, one category of impact that we're becoming more aware of is the mental health impacts of climate change, fires, droughts, heat, hurricanes, coastal erosion, etc. These varied events have nuanced effects on our mental health, from the need to socially isolate during smoke events to the anxiety and depression that can result from repeated weather-related disasters that strike the same communities over and over again, stoked by the impacts of climate change. And that is one of the reasons why I was so pleased to hear President Biden announce his unity agenda for the nation, the State of the Union address, which includes addressing the behavioral health issues that our country is currently facing, beating the opioid and overdose crisis, working on getting increased funding, getting rid of outdated prescription rules, and other necessary actions to stem the tide on the disease of addiction and overdoses. His agenda will aim to tackle mental health, especially among our children, our pediatric population. As Dr. Balbus mentioned, I'm a pediatrician, adolescent medicine physician. And so we have to deal with these issues of mental health in our children. This week, I had the honor of joining the second gentleman on a visit to Nationwide Children's Hospital in Columbus, Ohio. And we got to hear from behavioral health professionals and families about the importance of addressing the mental health needs of young people. And we got to thank the frontline workers for their work throughout the pandemic and discuss the importance of mental health resources for healthcare workers. Just this Wednesday, HHS Secretary Becerra announced a national tour to strengthen mental health across the country. And I, among others at HHS, will join him. I was with him yesterday discussing these very issues in Manchester, New Hampshire. So we at HHS are excited to work with the Secretary on behalf of the President's agenda to create a better future, both mentally and physically, for all of us in our nation. And HHS is committed to an evidence-based approach to understanding the barriers and addressing opportunity and equity. For those with existing mental health conditions, we need to pay attention to how climate change effects impact their conditions and how they could be compounded by adding additional stress which can lead to PTSD, trauma, and anxiety. Clinicians also need to be aware of the way psychiatric medicines may impair, for example, the body's ability to cool itself and the increased risk of heat-related illnesses. I know that is true from certain specific medications. And when it comes to young adults, we now have the first generation that has grown up with an understanding of climate change, and we're hearing more and more about their fear of the future, their sense of dread of the future. Yet also, these brave young people are some of our strongest voices, calling for action and calling for change. We need to make space to hear their concerns and their ideas for solutions. Many of you are probably aware of a recent review by Dr. Howard Frumkin entitled Hope, Health, and the Climate Crisis. Dr. Frumkin quotes Professor Thomas Homer Dixon as he highlights the distinction between hope that something might happen, which he calls a passive response, and hope to, which is active and bold. And so that's what we need to do. We need to have an active and bold agenda, which brings me to my closing, which is a call to action. So I have seen firsthand how organizations, individuals, and caregivers can work together to meet the health needs of their communities. I have seen what it takes to organize at the state level and what it takes to create change at the federal level, especially with change leaders such as Gina McCarthy. Having witnessed all of this and seen so much progress, I know that we can work together to create healthier communities. I am a positive and optimistic person, and I know we can do this. COVID-19 has taught us, like nothing else, that we are all interconnected, and we must work together to solve these problems. The climate crisis not only calls for a government approach, but a whole of society approach. And so I am calling on all of you today with a call to action. We cannot do this alone. We need all of you to stand with us. We need our hospitals and health systems to stand with us. And we need the private sector to stand with government. Given the health sector's significant contribution to carbon emissions and its role as a linchpin in orchestrating resilient responses to climate change threats, we are now in a place to lead lasting, meaningful change if we come together and act now. History is going to look back at this moment and going to remember us for the actions that we take or our failure to do so. To quote I'm going to say a recent play, but it was about 5 or 6 years ago, history has its eyes on us. I choose to take action. I choose to do everything I can to protect our health and our world's health for myself, my family, my community, and our nation. So please join me in answering this call. There's going to be a session tomorrow at noon on healthcare plans, path to decarbonization. So please, and I'd like to open it up for questions. Thank you.
I'm wondering whether we can wait until after Gina McCarthy speaks and have questions for both of you.
Of course.
We had a bit of a snafu with the technology, and so if that's possible, we can hear from Gina. I'm going to give a few words of introduction. For many of you, Gina McCarthy scarcely needs an introduction. She is the first ever National Climate Advisor. In other words, she is the president's most important advisor on climate change. She leads the White House Office of Domestic Climate Policy, where she chairs a cabinet full of executive agency leaders who try to carry out those executive orders you have heard so much about, especially the one to pursue the all-of-government approach to addressing climate change. Previously, Gina was the head of the EPA, at a time when major policy initiatives to address the climate crisis were tried for the first time. Her work helped pave the way for the 2015 Paris Climate Agreement. Also in 2015, the Clean Power Plan was announced as the first ever national effort to lower carbon emissions from power generating plants. But also under Gina's leadership, the EPA finalized regulations to address mercury and toxic air emissions and took steps to improve regulation of ozone and particulates, clean the water, and reduce chemical exposures. She pushed the agency to fully live up to its charge. While you can read Gina's full bio in your program guide, to honor her, I'd like to share a few words of tribute from others as well, other well-known members of our community, in fact. Edward Maybach said, "No one has fought longer, harder, or more successfully for the health of the American people and for the environment on which our health depends than Gina McCarthy." Katie Huffling of the Alliance of Nurses of Healthy Environments said, "We are so lucky to have Gina McCarthy working side by side with us in support of a healthier planet for all. Her passion for the environment and public health, her commitment to future generations, and awesome sense of humor shine and make her a force to be reckoned with." Laura Kate Bender of the American Lung Association said, "Gina McCarthy has amassed decades of leadership on clean air and climate efforts. And when it comes to seeing climate action as not just an environmental issue, but a health and racial justice issue imperative, simply put, she gets it. She has the power to drive action on climate change that seizes the opportunity to build a healthier and more just nation." Finally, our advisory board member, Dr. Howie Frumpkin, said, "Gina is a superhuman combination of environmental expertise, health expertise, political savvy, communication skills, tenacity, and humor. She's a gift to the nation and the world." I give you Gina McCarthy.
Well, I don't know how to follow that. I can be nothing but disappointing to everybody now. But really, thank you so much, both Dr. Sarfaty, but also all the folks who said such kind things. I think people are really at this point ready to act, and it's a most exciting moment. But let me also recognize the leadership of Admiral Levine, and I think you'll hear from Dr. Balbus later. Boy, she is a hard act to follow. But we have been ramping up at HHS because of their leadership. And it's wonderful to see health such a prominent feature of the discussions around climate change. So thank you all for all of the work that you've been doing and they've been doing, because it's all because of you. You know, you have ramped up your anxiety and your interest in taking action on climate change. And the role of health professionals really can't be underplayed in any way. It is absolutely critical. So thank you for everybody participating, but for all of the great work that you're doing, both physicians and other health professionals who've worked tirelessly to treat and to lead Americans through the pandemic, and who are also taking up the mantle to advocate for climate action. You know, we all know that climate change and health are inseparable. They are closely linked, because the impacts from air pollution and extreme temperatures and weather disasters, as well as the flood insecurity and the mental health challenges, are palpable. We can all see them. And so many of them are either created by or exacerbated by climate change. And I know that health professionals have an incredibly unique ability to bring home to Americans how climate change is already having direct impacts on their lives and their health and the health of their communities. So thank you to so many of you for using your voice, for using your credibility to make climate threat real for everyone. We know this is an urgent problem, but we also know how important it is to not pile on after 2+ years of this horrible pandemic. People don't need more fear. What they need are answers. What they need is hope. And that's what we can deliver for them, and hopefully are delivering right now. because that's why I joined the Biden administration. We have answers, not all we need, but enough to jumpstart new ways of doing business so that we can give people the sense of hope that they so desperately need, especially our young people who are so committed and, as Dr. Levine indicated, so anxious as well that we see progress being made. That is why we have to be both straight talking about the challenges as well as excited to communicate the enormous benefits of climate solutions, which I know your consortium is working so hard on. You know, as President Biden understands, both the urgency of this moment is important, but the opportunities that we have today to build a clean energy economy is vital to focus and get energized around, because when those opportunities create good paying jobs for better quality of life, we can improve our air quality and our health outcomes in our neighborhoods, and we can reduce costs to our families if we move on the opportunities available to us today. In fact, in his first week in office, the president set up this national climate task force that I chair. And the whole idea is to marshal a coordinated federal climate response that includes the Secretary of Health and Human Services. Yay! And through our whole of government response, we've made historic progress to tackle emissions across sectors, including by fast tracking solar and wind projects at levels that nobody had anticipated, rallying automakers and auto workers around an electric vehicle future. That's how we're going to clean our air, and advancing clean manufacturing and industrial processes. We're also all working across the agencies to build resilience against the multidimensional impacts of climate change. For example, as Admiral Levine indicated, our extreme heat working group launched a coordinated interagency effort to address extreme heat, including developing the first ever federal standards on heat risk in workplaces to respond to the extreme heat that threatens the lives and livelihoods of so many Americans. Our wildfire working group is also working to reduce fire risk and protect communities from dangerous smoke and other health impacts. But as you know, we secured major legislative victories through all of our hard work with the passage of the bipartisan infrastructure law that President Biden worked so hard to get. And we're using that law to clean up our transportation sector by making historic investments in clean and electric vehicle charging infrastructure and clean schools and transit buses. These programs will reduce greenhouse gas emissions and local air pollution that disproportionately impacts low-income and communities of color. We've secured the largest investments in cleaning up legacy pollution, such as Superfund sites, abandoned mine lands, orphan oil and gas wells, which have been sources of methane emissions for so many years, as well as toxic air pollutants that you know as well as I do harm our communities and especially our children and our communities of color. The bipartisan infrastructure law also delivers clean water to American families. So by getting rid of those lead service lines and dealing with emerging contaminants like PFAS that can lead to adverse health effects. This funding builds on the administration's whole of government effort to reduce lead exposure through not just lead pipes, but lead paint action as well. And across all of our climate efforts, we are, as Admiral Levine indicated, focusing squarely on environmental justice. It is not an ancillary issue. It is one of the key priorities of this administration, because we know that communities have been left behind. They're the ones that have been bearing the brunt of pollution and disinvestment and now climate change. That's why we've been implementing the President's Justice 40 initiative, so that we can make sure that federal investments go to those communities. And we're recently launching our climate and economic justice screening tool, which you can check out It's our way of making sure that we can track progress. We have to tackle this issue as we tackle the opportunities ahead. You know, the health sector has been, with your leadership, stepping up, and we're so excited because you're such trusted messengers. And you're also working in a sector that is a significant contributor to US greenhouse gas emissions. In fact, the healthcare system is responsible for 8.5% of the total US emissions. So we know how hard you're working. We know that you're making commitments to decarbonization. We have to have a health system that really works together with all of their constituents to tackle this climate crisis by tracking their own emissions, by investing in clean energy, and working with their local communities every step of the way. Look, I know we're all doing our part, and I know the Department of Health and Human Services is really pushing forward like they never have before. And we all know that we're doing this because climate change isn't a planetary problem. It is a people problem. We are the ones who have to take action because it is our lives and our livelihoods and our children's future that depends on it. And I know with your continued leadership, we can really meet this critical moment in time. We have the wherewithal. We can energize people, give them hope again, and move forward together. Thank you very much for everything you're doing and for giving me a few moments of your time.
Oh, Mona, you're on mute.
Thanks. Okay. Thank you both. We're so incredibly fortunate to have both of you here this morning. And, you know, your words are incredibly important to us. And so I have a couple of questions that people have put forward, if it's okay with you.
Sure.
I'll go ahead and share them. So first of all, for Gina, what do you think, actually for both of you, what do you think is the most useful thing that climate health equity advocates can do at this time to ensure that we see that Congress move forward with the climate proposals currently on the table?
Well, Dr. Sarfaty, first of all, you are such a hero, and I hope I mentioned that carefully because you've been amazing. But, you know, I think the most important thing that you can do is really use your voice every chance you get. You know, the president was very committed to moving forward with climate action under the Build Back Better plan. He remains entirely committed to that. And while folks on the Hill are saying, yep, we have to get this done, it always ends up being part of a long sequence of actions. We need it to be front and center. So talk to your communities, talk to your constituents, and also make sure that you talk to your congressmen and congresswomen so that everybody stands together and gets the commitment that we need. In particular, the tax credits that are going to allow us to advance both clean energy and clean manufacturing. We have to move faster every day. And this is going to give us the ability to accelerate the shift to clean energy, which by its very nature means we're going to start reducing the fossil fuel impacts that we all know are impacting our health and our economy as well.
Well, thank you. I don't really have much to add to what Gina says. It's important for all of us to use our voice with our elected officials on this critically important issue.
Admiral Levine, let me ask you, so that we can build the kind of resilience that you referred to with special attention to mental health impacts that we're seeing, and especially in children, what can local health professionals do that would contribute to that work?
Well, I think it's important that we all collaborate together. So, you know, previously to being in this position, I was a state health official, and previous to that, I was a physician in academic medicine at the Penn State College of Medicine. I think that local health officials and local medical professionals need to use their voice. They need to advocate that their health systems, their local health officials and local governments, their states work with us to address these issues. As I mentioned, we cannot do this alone, and the federal, and in our system, the federal government needs to collaborate with state and local governments. So I think it's really important that people, medical professionals, use their voice locally to help us nationally and internationally.
Yeah, thank you for that. We have many mental health professionals, psychiatrists, psychologists, social workers who are part of our network, and we hear frequently about what they're seeing locally, and it is definitely of great concern to all of us. I also have a question here about the drumbeat for drill, 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 especially given the current international situation. Any suggestions about how people can respond to that?
Well, I think that, part of the challenge that we are facing right now is clearly the fact that people are looking at this current war with startled eyes. I have to say that I never thought I'd live to see, and certainly hoped I never would, another war like this. It's tragic. And there are some steps being taken to make sure that it doesn't result in huge increases in fossil fuel costs, because we are still heavily reliant, in many of us, on fossil fuels, not just the US, but the EU and others. And so we have to recognize two things. One is that this is a short-term issue that needs to be addressed, but most importantly for all of us, that it should never send a signal that fossil fuels are our future. In fact, these kinds of challenges we're seeing across the world are actually built around an instability that is very much fossil fuel. Fossil fuels has been one of those products that can be manipulated. Prices can skyrocket by artificially holding fossil fuels back. There have always been generations of wars that have resulted around these challenges. And so the only really way to build security and stability in our world is to move forward with clean energy. Our country can get more stable as well as healthier if we just focus. So hopefully this short-term glitch will do nothing but remind people that fossil fuels is not the future. Our future is in clean energy that we control, we can deliver ourselves, and every other country can similarly take action to make sure that we make that shift away from fossil fuels, but do it in a way that doesn't have short-term damage. We don't need to do those short-term actions that will rely on this fossil fuels forever. We just need to address the challenge of today and swiftly move to a clean energy future.
Thank you so much. There's another question on mental health that clearly is a major concern. We hear it so frequently. And before I ask the question, I want to point out that we have an author spotlight, Meet the Author, scheduled this afternoon during the chat, and also tomorrow afternoon. And tomorrow afternoon, there will be two authors of children's books that have been specifically written to help introduce children to some of the concepts around climate change and to build resilience and a sense of how they can respond in a way that is age appropriate and helps them to cope. So here's the question. What do you suggest for improving psychosocial resilience and social cohesion at the community level? Clearly, that is an area that people feel after 2 years of pandemic and a lot of staying home, they've drifted away from a focus on their community. And so how can we help to build that community level resilience?
Well, you're entirely correct. The mental health challenges facing our nation are considerable, and that is why President Biden highlighted those in his State of the Union address, and why I was able to join the second gentleman on Wednesday, the day after the address, to discuss those issues, and yesterday with Secretary Becerra. So we're going to be emphasizing mental health issues associated with COVID-19, mental health issues associated with, as we've been discussing, the threat of climate change, especially that we're seeing in our children. But we're going to do that from the federal level. But I want to emphasize again, and I have again experience being a state health official and then working in my local community in Hershey, Pennsylvania, that we need to all work together. It has to be that collaborative approach between the federal government, state governments, and local governments and health professionals at all those levels to do change. So at HHS, we will be funding through grants, through all of our different divisions, local programs to help local officials and local mental health officials address the challenges at their local level, because there are similar challenges across the country, and then there are local nuances that are critical for us to consider. So that's what we're going to do. We're going to go out and we're going to get the message across, and we're going to collaborate across those levels on dealing with these issues.
Thank you so much. We have just 2 more minutes here. And so there's one question that focuses on the international situation. I'll put that to both of you. And the question is really, given the IPCC reported this last week and saying that governments are not doing enough, what else can the US government do that can move other nations to faster action? Clearly, this is a very difficult international situation we're facing right now. And what do you think are the best strategies, even in light of the international situation, that we can encourage, that the US government can do to encourage other nations?
Well, let me just say that we have an international office that is working incredibly hard. I think folks know Secretary John Kerry, who is in charge of that office right now. We're trying to provide the leadership that we had lost, frankly, during the prior administration, and make sure that we're out as strong as we can, setting the kind of goals that we need to have, which is net zero by 2050. We're looking at clean energy by 2035. We're looking at moving the electric vehicle car sector to be cut in half, the fossil fuel cars on the roads, as quickly as we possibly can. And so these efforts are underway. I think they're showing the world our commitment, but there is no question that climate change is a significant challenge, because you have to, in the end, look at how you grow your economy. President Biden has been very clear that we're shifting to clean energy, but he's also been very clear that that shift is how we're going to grow jobs. It is how we're going to make the world healthier. It is how we're going to make the world more resilient and adaptive. And it is, in the end, how we're going to win the 21st century economy. So it's incredibly important for us to make sure, consistent with your prior question on mental health, that we tell people that there is a path forward, but there has to be an all-out effort on the international level to have every state that's engaged in our climate effort develop a plan that gets us where we need to go. And we all work together to make sure that the technologies and products are invested in that will get us there. And that's the whole issue. And so it is difficult. It's hard to foresee how to get from here to there, but momentum will build with every step forward we take.
The only thing I'd like to add is that is why it was so critical that we have a trusted, experienced leader such as President Biden and Vice President Harris. I mean, given the challenges that we face, which we understand are considerable, the COVID-19 pandemic, the international issues in Ukraine, the risks of climate change. That is exactly why we need a leader of President Biden's stature to lead our nation and to lead the world with trusted, experienced leaders such as Gina McCarthy, such as Secretary Kerry, such as Secretary Becerra. And so that's exactly why they are here and why we are here to deal with those issues.
Well, we feel incredibly fortunate to have had both of you here with us today. So thank you so much for taking the time out to speak with us. And we will definitely be doing all we can over the next year to advance these goals. And thank you again. We couldn't be more appreciative of your service, your leadership, and your guidance.